they're going to make many of those. Most of those are not used for surgical grade. They're industrial grade, but they've had a waiver to make sure that those that there's no liability as it relates to those, and that will bring I can't recall off the top of my head, but it's a substantial number into the system that were not there before. Yeah, from the construction industry and things like that. So. That will bring a lot of new masks and PPE equipment on the scene. The private sector, Roche, Abbott Labs, and others have introduced, the president was announcing that they're introduced testing kits that they're going to try to get out to people across the country as fast as that. It's happening. I'm sure that they have a release on the details of what those numbers are.
And you mentioned ventilators as well, is that right?
They had a whole process that they were talking about with ventilators. I would encourage you to address that with the administration briefing numbers. They have a release out on all that.
All right, thank you.
Adrienne Robbins, NBC4. My question's for Governor DeWine. Comes from our sister station in Cincinnati. They're wondering, have you thought at all about closing some of the campuses, the large campuses like the IRS down in Cincinnati where thousands of employees are continuing to work?
We continue to look at different places, different opportunities to reduce where people are coming together. Again, whether it's the IRS or whoever it is, we're asking them to observe an employee of the IRS or any place else to be walking into a situation that is not good. Any of their workers who can work from home, we would certainly ask the federal government to be doing what we ask everybody else to do, which is to let them work from home.
All right, thank you.
Laura Hancock from Cleveland.com. I just have a question about resources at the Department of Health. You guys have discussed young people at the beach, but we really don't know how many of these 119 people who are sick are in their 20s or 30s, 40s, so on. What is your ability to do that? Are you guys just stretched for resources?
Laura, we're putting out the demographic and detailed numbers as absolutely fast as we can. As you can imagine, we're taking in that information at the county level. Local health departments, of which we have 113, are really leading the way in the press releases now. There are certain things that they'll be coming to you with first, and we'll be receiving that. But we are receiving data now from private labs and hospital labs and our own labs. So some of that just takes a while to compile. Thank you.
Thanks. And along those lines, we have roughly 6 hospitals in Ohio that are testing, and Cleveland Clinic and UH can do at least 600, maybe 1,000 now a day. Yeah. Do we have any, like when I look at the national testing situation in different states, Ohio's got a lot of testing compared to smaller states, but I don't know, what's our rate of testing? Do we know?
You know, we have maximized the testing capacity that we have been given, as you know, pretty amazing healthcare systems, and we did stand up our, what has been called drive-through. It sounds erroneous, but we had, with a doctor's order, testing. As you know, there has been a lack of swabs and some of the media that is actually in the vial that you put it in. So even though we had tremendous capability to test, we didn't have all that. We're making corrections every day. I'll reiterate this one more time. I think it might be helpful, and I'm going to try to put this on our website. We're talking about testing right now and saving our testing capability for those highest risk folks. That will be our hospital and healthcare workers, our hospitalized patients, and those high-risk patients that are, that 20% that are going to be really surging any second now on our hospitals. So we're doing that because we need to protect and know who we need to use that wisely. And then also those frontline responders, so the firefighters and the police and the EMS. And that's how we're going to triage that. We'll have that on our website. Remember, folks at home, because I know this is scary, and I've had to ask even a mayor, please, but we could talk about what we have. We have to fight the war we have with what we have. And we will go back forward. And so if you are home and your doctor knows and does a history with you and tells you, ride this out at home, there's no difference in what they're going to tell you to treat it, whether you are tested or not. Even if you are tested, you might test negative because you're too early in your illness. So the lack of testing is not going to stop us from treating you well and treating your symptoms well. So as I always say, we will tell you everything we know as we know it. Please go to our website, listen to your provider, and we will, as we gather that, we're going to be hearing more and more in the days to come about our hospital capacity. Quite honestly, we're inventing some amazing things as we go, and therefore we'll share it with you. Laura, as you know, we became as transparent as we are. In a weird way, I owe you a thanks, because saying that I was not being transparent, which was like, everyone in my family has to say, stop saying so much. So, but because of that, it really led to this commitment we've made, and we will honor that. Thank you.
Well, thank you for these briefings. Thanks.
Hi, Laura Bischoff, Dayton Daily News. This is a question for Dr. Acton. I was reading that Imperial College study last night on non-pharmacological interventions. Super fun reading. It talks about this home isolation and social distancing interventions that they need to be maintained until a vaccine. Could be as long as 18 months. Can you give us a realistic time frame of, how long you think Ohio is going to be in the situation that we're in?
So, I think everyone definitely, if you're following the news at all, we need to realize that this is a long haul. But I think we have to take it as it comes, because so much will evolve. If some of these drugs that we're testing make a difference, that will be a new tool in our tool chest. So you're going to see us take the best science, which is the non-pharmacologic interventions, those 4 things I mentioned before, the early targeted layered interventions. Rewind back to one of these earlier press conferences to learn more about that. That's what we're deploying right now. But that will depend on so many different factors. The other thing, and you're going to watch China go through this right now, how do you exit that? Like, how do you peel back those layers without creating a surge of infection? And I beg, we have love to be a part of conversations, because I'm sure they're going on all over the world right now. But I think as our testing, this is where our testing, when it ramps up, will be invaluable, because what we need to do is do sort of a health monitoring of our whole population. And there will be tests that can look back at blood. So there are a lot of innovations. Again, this is an unprecedented situation. And so there will be some strategies that are going to help us walk out of this time period. So stay tuned on that. I know when you hear words like 18 months, that it just adds a layer of just impossibility. This is the art of the possible. An old mentor from the Columbus Foundation, Drag Kryler, had this beautiful poster that I still keep with me every day about the art of the possible. And there's so much possibility in what people are discovering right now. So nothing's for sure, and everything we do every day makes.
Thank you.
Governor, I'm told I have the last question. Andy Chow with Ohio Public Radio and Television State House News Bureau. There are private, quote-unquote, non-essential businesses out there that say that they cannot close unless you tell them to close. Do you see that to be the case, or is it on them? Is it an individual's responsibility to close if they think they should?
Look, we're happy to talk to any company like that. We have had situations in the past when we started through this. Some of the early decisions, we were told that, we would tell somebody to close, and they said, well, you have to order us to close. And they had some legal reasons, insurance reasons, other reasons. So we're open certainly to discussion. I mean, the ultimate goal here is to keep people safe, and we're happy to talk with them.
Thank you.
Thanks, Andy. Thank you, everybody. We'll see you all tomorrow. Thank you very much.
And hearing from the leaders of several states today. In about 20 minutes, a briefing expected from Georgia Governor Brian Kemp. Plan to bring that to you live at 4:30 Eastern Time here on C-SPAN. On Capitol Hill, the U.S. Senate continues its work on Phase 3 of the coronavirus relief bill. Majority Leader Mitch McConnell says he's going to keep the Senate in session until the legislation is passed and sent to the House. Reports say the bill may amount to $1 trillion or more. You can watch the Senate live right now on C-SPAN 2. CQ reports some lawmakers are pushing to include language to prohibit surprise medical bills in the third legislative package, responding to priorities since last year. But industry groups disagree on how to determine payment disputes, and squabbles between committees have slowed down those efforts. You can read more at cq.com. It's easy to follow the federal response to the coronavirus outbreak at cspan.org/coronavirus. Track the spread throughout the U.S. and the world with interactive maps and charts. Watch briefings and hearings with public health specialists anytime, unfiltered, at cspan.org/coronavirus. Television has changed since C-SPAN began 41 years ago. But our mission continues, to provide an unfiltered view of government. Already this year, we've brought you primary election coverage, the presidential impeachment process, and now the federal response to the coronavirus. You can watch all of C-SPAN or listen on our free radio app and be part of the national conversation through C-SPAN's daily Washington Journal program or through our social media feeds. C-SPAN, created by private industry, America's cable television companies, as a public service, and brought to you today by your television provider. We heard earlier today from the National Guard on their response to the coronavirus outbreak. Here's General Joseph Lengyel, National Guard Bureau Chief. He spoke for about 25 minutes.
Thank you. Good morning, everybody. I'm glad to be here today to fill you in on what's going on in the National Guard. So today we face a national emergency in this COVID-19 pandemic. This is a serious situation, and we are all concerned about the health and safety of our fellow Americans, our first responders, and our citizen soldiers and airmen. Thus far, 6 members of the National Guard have tested force health protection measures in place and will continue to keep our National Guard members informed as the situation develops. We all play an important part in ensuring the health and safety of our communities, and this responsibility we take seriously. We are here to support each other and to support our communities. I want to take this opportunity to talk about what the National Guard is doing in response to COVID-19. First of all, it's a historic event, unlike any we have faced in recent years. For example, when there's a hurricane, you can see it on a map. You have a sense of how hard the storm will hit and how long the storm will last. With COVID-19, it's like we have 54 separate hurricanes in every state, territory, and the District of Columbia. Some are Category 5, some are Category 3s, some are Category 1s. Unlike a hurricane, we don't know when this is going to dissipate or move out to sea. But a historic event demands a historic response, and that's what the National Guard is prepared to as America's principal domestic military response force. The National Guard is a unique military part of the Army. But if you were going to design an ideal military component to assist with a response like this, it would be a component like the National Guard. We are 450,000 strong in every state, territory, nearly every zip code in the country. When disaster strikes, we don't have to mobilize from some base. We pack a lunch, we go to work because we are already there in the communities where these events are taking place. We live there. We can respond faster. We bring our military training, equipment, and experience to help our communities here at home. What we offer is unlike any other military component to our communities. While circumstances will continue to evolve, here are the facts as they stand. All 54 states, territories, and the District of Columbia have declared a state of emergency. Governors in 27 states have activated parts of their National Guard. Across those 27 states, at this time, 2,050 National Guard members have been brought on. We anticipate that number going up relatively quickly, in fact, doubling by this weekend. And we expect the total number of Guardsmen activated will increase rapidly as test kits become available and as the situation unfolds. We are ready to respond depending on the needs of the community and as ordered by the response network by the governors in every state. We are involved in a multitude of mission sets and functional areas. The National Guard is providing medical testing assessments, facilities, ground transportation, logistics, command and control, planners, liaison officers, and we will continue to adapt as this unfolds. We are already making a difference in communities across the country. For example, the New York National Guard have been helping local officials distribute food to those who need it, much in the hard-hit area of New Rochelle. The Tennessee Air National Guard C-17 delivered swabs, 500,000 swabs to be added just yesterday. In South Florida, more than 500 soldiers are assisting with collecting samples for drive-through testing in Broward County. In Maryland, the National Guard is supporting medical assessments and testing site operations. Wisconsin are supporting transportation missions for the Wisconsin Department of Health Services. In Louisiana, Guard liaison officers are assisting the New Orleans Office of Homeland Security and Emergency Preparedness. And across the country, our civil support teams are supporting the local departments of health with drive-through testing stations. It was just 2 weeks ago, California National Guard started this with the California National Guard who delivered test kits to the Grand Princess cruise ship off the coast. This is just a sample of the efforts that we are supporting across the country. Going forward, we expect the role of the National Guard will continue to grow and evolve to meet the country's needs during this historic pandemic. I want to thank all of our Guard members and all the first responders for their service during this difficult time. We continue to rise to every challenge before us and continue to work with our partners to keep our nation safe. We remain true to our motto, always ready, always there. I appreciate your time, and I look forward to your questions.
General Bob Burns from AP. You mentioned that the 2,000 plus Guard members who have been called up by governors at this point. I'm wondering, is there any discussion you're having, others are having, about the possibility of mobilizing the Guard under federal authority? And what would be the advantage of doing that?
So, you know, the National Guard is a reserve component of the United States Army and Air Force, and certainly if the President, with this declaration, if he wanted to mobilize the National Guard in a Title X federal status, he could do that. But that would not make sense in this situation. The best use of the National Guard is to use the National Guard for the unique the command and control of the networks in the states. Every state has a different way to deal with disasters, and the National Guard is uniquely qualified and postured to act under the command and control of the governors in the state. And so if you were to federalize them, you would lose that ability, and you would lose some other things. For instance, a unique attribute of the National Guard is we can operate as law enforcement capacity to assist state and local law enforcement inside the states. And if you were to federalize the National Guard, then you would lose that ability to do that. So while, I mean, certainly the President can mobilize and federalize the National Guard, but it would be my advice, and there's no plans that I'm aware of to take the National Guards in the states and put them in a federal status. They're much better used in a state status under command and control of the governors.
Thank you.
General, you talked about the Tennessee Guard moving those 500,000 swabs to Memphis. I guess walk us through what you think the Guard role will be after that point. I mean, do you, after the tests are done, do Guard members get them to the labs? I mean, what do you expect your role to be? Because that's a large volume of swabs, obviously.
Sure.
Once that starts moving.
So, you know, I think that you know, best determined by the situation in each and every state and the capacities in each and every state from what they have as in the civilian sector and in the public health sector and all the rest. The National Guard will be used in a variety. Some and I know Tennessee is planning to establish perhaps drive-through test sites. You know, we have a medical capability where we can train members of the National Guard to actually administer the tests, or support other civilian medical professionals who might administer the test. So we could clearly be involved in directly administering the test if that was the case. I mean, some states, Colorado, New York, Rhode Island tests, and I mentioned this morning, Florida is rapidly expanding to do that. We could be the transportation mechanism that actually delivers and equips the various drive-through test sites that are out there. Logistics, command and control, planning, we can help the emergency response network plan that. So all of the functional messages that I mentioned earlier in my opening remarks will be involved across the spectrum as individual states see fit. And that's what's best about the way it's set now, as you may think, well, there's only 2,050 members on state active duty. As these mission sets and requirements develop, the governors can incrementally bring, and even though there's only 27 that have added National Guard members, about how best to integrate. They're integrating with the public health services inside the states and come available and come on duty in a matter of hours, and that's good.
So you have 2,000 roughly Guard members taking part in this, and you said it'll double, I guess, by this weekend.
As I had
What the planning show you is for down the road, a month, 2 months, what are you telling your Guard members? Do you expect it to go up? I mean, it gives a sense of the number.
it's hard to tell what the exact requirement will be, but I'm expecting tens of thousands to be used inside the states as this grows. And I think that states have the capacity and are planning to do those kinds of things. Just as I had I've been having calls with the adjutants generals in every state, but I think that this could quickly blossom in the next couple of weeks as governors and states determine their needs and ways to use their National Guards.
Thank you. Tara Kopp with McClatchy. You also plan for hurricanes, and we've learned that this could go well into July and August, deep into hurricane season. What sort of planning are you doing right now for communities, coastal communities that may be in self-quarantine? You might be dealing with these two disasters at once.
Sure. I think, there are many things that the Department of Defense and the National Guard is going to have to do. I mean, we're still ongoing with our continuous deployments around the world to every combatant commander. States are still planning, particularly in the Gulf Coast, and for hurricanes that will come up along the side. I mean, we're dealing with this issue right now as the closest, nearest issue that the states have to deal with. But, if and when a hurricane were to come, the states will be prepared, and the emergency response network, FEMA, the whole apparatus will be ready to come together and deal with that if we have to do it as well.
But what sort of planning, I think, or are you doing planning already? Because, if a hurricane comes, everyone's told to evacuate, but what if you have a community?
Yeah, well, I think that's a good question. I mean, right now, I think we're in the midst of dealing with this pandemic and the flu, and every state every year plans to deal with evacuation procedures and policies and how are we going to get our people away from the coast. So I think that those plans are sitting there on the shelf. We may have to adapt how we do it if people are, if there's quarantine things out there. But hopefully by July, August timeframe, when the hurricanes hit with the traditional size, it perhaps could be mitigated by then, but we'll just have to deal with that when it comes to it.
Okay, for everybody that we've got on the phones right now, I'd like to remind the media that's on our phone lines to mute your phones. We're getting a lot of feedback on the lines, so please, we'll be going to you shortly. Phil?
You have over 21,000 Guard overseas. Is there any thought that as this crisis accelerates in the coming weeks, which is the projection, actually this could be your priority? The national mission could be your priority as opposed to the overseas mission. Is there any thought about kind of reconfiguring how the Guard does business, dividing up its priorities?
So, the National Guard is a combat reserve of the United States Army and United States Air Force. And so we have the role that we play as part of the Army and the Air Force, I think, will continue. And so, to bring people home from current mission, if you bring people home that are doing mission overseas, there are national security implications of what we're doing around the world. Those are important things. You'll have to send another piece over there to replace them. So the way the Department of Defense is built these days is it doesn't do really any mission around the world without using pieces of the reserve component and the National Guard. So I don't think there are plans to retrieve missions that have been mobilized overseas at this point.